If you are trying to rapidly lower your blood pressure at home, dial 911 immediately. You cannot safely treat dangerous high blood pressure at home. Your best move is to lie down flat and calm yourself until emergency help arrives. Your blood pressure refers to the pressure inside your artery walls. It can be a little higher or lower throughout the day as you move from relaxation to activity and back again. High blood pressure. High blood pressure is common, and many Americans don't know they have it. Elevated blood pressure is defined as above 120 systolic, but below 80 diastolic at rest. High blood pressure in adults is defined as resting blood pressure above 130/80, but keep in mind that women's readings tend to be about 5 points lower. And blood pressure averages also vary by age group. Lowering blood pressure immediately. There is very little you can do outside of medical intervention to lower your blood pressure immediately. If you are concerned you may be experiencing a high blood pressure emergency, call your doctor right away. As you wait for help to arrive, lie flat and remain as calm as possible. Lose weight. Being overweight or obese puts added pressure on your arteries, and this can lead to high blood pressure over time. The American Heart Association recommends eating well and moving off for people who want to lose weight. Lower sodium consumption. Too much sodium in the diet has been tied to high blood pressure. In places where people eat less sodium, people tend to have much less trouble with high blood pressure. Eating healthy. Some foods are just good for your heart, and then there are foods that aren't. The more often you choose quality, healthy foods to eat, the more protection you give your heart. Alcohol. Drinking too much alcohol has been associated with high blood pressure. Heavy drinking also contributes to stroke. The CDC recommends that men drink 2 or fewer drinks per day. Women are recommended to drink 1 or fewer alcoholic beverages per day. Smoking. Smoking constricts the arteries, and that raises blood pressure for a few minutes. Smoking all day can contribute to higher blood pressure all day long. High blood pressure kills nearly 500,000 Americans every year. If you smoke, monitor blood pressure regularly. Know you have high blood pressure? Check it frequently. Doctors recommend daily checks with a home blood pressure monitor. Check 3 times, and record each result. Be particularly careful to check your